My name is Mwalimu Festus. I'm a BSN, and today I want to talk to you about a condition called pulmonale. Pulmonale is Corpulmonale. So what is this copulmonary? It's a condition where the right side of the heart enlarges and weakens, and it weakens due to long-term blood pressure in the lungs, and that's why we are talking of pulmonary. It is in the lungs where the pulmonary hypertension usually causes a chronic lung disease such as COPD or emphysema. We have other causes apart from COPD. Apart from obstructive pulmonary disease and emphysema, we have chronic bronchitis. We also have pulmonary embolism and also interstitial lung disease. And sometimes because of sleep apnea, a long-term untreated obstructive sleep apnea, normally called OSA by ENTs, a causes called pulmonary. And what is this pathophysiology of called pulmonary? Due to lung disease, in this case, COPD, mentioned as COPD or emphysema, chronic bronchitis, pulmonary embolism, or interstitial lung disease or sleep apnea obstruction, it makes the body have low oxygen, which is hypoxia, and the blood vessels in the lungs constrict. Due to this constriction, the pulmonary hypertension increases, and in the right ventricle, the work is very hard in terms of pumping mechanism. The pump does not pump blood the right way into the lungs, and due to the overtime chronic disease, this problem makes the right ventricle get hypertrophied. The hypertrophic right ventricle causes the failure. This is what we are calling now copulmonary. And there are symptoms that come with it, and they might be misdiagnosed because of what we call comorbidities like the heart failure and other conditions. Uh, so we have symptoms like shortness of breath, especially on exertion. When you're trying to do something or to climb the staircases, or when you're doing an activity, there is shortness of breath. Then there is fatigue and weaknesses. And of course, swelling of the ankle, feet, or leg, edema. Patient will present with edema. And also there is enlarged jugular vein. Jugular vein distension is the jugular, you will see patient with pump, like the jugular vein is very distended, it's pulled outside and it pumps like this. You see something distended, a very big vein over here. That is jugular vein distension. And there is also chest discomfort or pain because the lungs have enlarged, they are inflamed. There is a lot of pain and chest discomfort because the oxygen is not getting. And it is because it is in the right side. That's why you find that there is cyanosis or bluish skin or lips. Lips become bluish because it's coming from the right side. There is cyanosis. Anything that involves the right side of the heart, you find in most cases there is cyanosis. And how do we treat this copulmonary? Copulmonary is basically you treat the underlying cause, and we have mentioned some of them like COPD, bronchitis, chronic bronchitis, pulmonary embolism. So you have to treat the underlying cause. And also, our patient needs oxygen therapy to reduce the pulmonary pressure. And also, patient requires diuretics to relieve the swelling by removing a lot of water from the system. And also bronchodilators that ease the breathing, because we need the bronchs to expand. We want the lungs to expand well, to allow air get in because of the obstruction. Then also patient requires digitalis. Remember, there is inflammation of the lungs, and there is pulmonary hypertension. And therefore, because of that swelling and inflammation, the patient, uh, the pumping mechanism has failed. So we need digitalis like digoxin to pump to increase the pumping mechanism. So, and also patient are told to avoid smoking and respiratory infection, because smoking increases vasoconstriction and increases pulmonary hypertension. So thank you. That is what we had today about copulmonary. I hope you have something that you, when you see patient with edema, it's not always CKD patient, it's not always DKA patient with pulmonary with edema. So think of the right heart failure condition like pulmonary, and you're going to have the right diagnosis when you take your time in a calm way and diagnose the patient. Thank you.